Hey guys, do you ever struggle with feeling that pinching sensation at maybe the bottom of your squat or anytime you bring your knee closer to your chest? If you are, you could be struggling with something we call hip impingement. So basically, one of the things that will contribute to hip impingement is if we look at the head of the femur in our hip and the socket, which is on the pelvis, they create what's known as a ball and socket joint. Ideally, when we move, the head of that femur has to stay pretty well centered in the socket as we lift that leg up and down. When it doesn't, and it starts to either drive kind of upward or forward too much, we end up with that well-known pinching sensation. And this typically happens anytime our knee comes closer to our chest. So I want to show you a little bit about how you can start to resolve this problem. So what you're going to do is you're going to grab a TheraBand, a pretty thick one. So this is actually a pull-up band. You can also use a yoga strap or even just a bath towel at your house. And what you're going to do is you're going to lay on your back with both of your knees bent, okay? Now the first step in making sure that you do this exercise correctly is that we are maintaining what's known as a neutral spine. So basically there's just a little bit of a curve to your back when we're standing, and we want to maintain that natural position when we're laying down. This means I'm not going to let my butt tuck under, and I'm most certainly not going to let it arch up away from the table. I just kind of want to be resting between those two positions. From here, I'm going to try to take that knee and lift it towards my chest. And when you do that, I want you to note, do you feel a pinch sensation or pain at the top of that range of motion or really anywhere through that marching position? If you do, here's what I want you to try. You're going to grab that band and you're going to place it around the back of your knee. So now the muscles don't have to work quite as hard. And what I'm going to do is I'm going to take my arms and I'm going to use my arms and the band to assist my leg up into that position. Now my muscles in my hip can actually remain relaxed so that I'm not getting too much forward pressure at the head of the femur. So as I'm doing this, what I'm trying to visualize and imagine is the head of my femur driving back into that socket, so down towards the table. Now it's not physically going to go anywhere. There's nowhere for it to go. But just imagining that sensation of that downward glide is going to help you achieve a greater range of motion, hopefully without feeling any sort of pinching. And I want you to just practice it with your arms. Now make sure you continue to maintain that neutral position, so no flattening of that spine when you bring your knee towards your chest. So we got to kind of relax through that pelvis a little bit more. When you can get it to the point where you can get higher into that range of motion, or at least to the point right before you feel the pinch, what I want you to do is lessen your grip on the band and see if you can hold it there without re-feeling that pinching sensation. And then you can even try to lower it down without the band assistance. Good, and then I'm going to do it again. I'm going to pull that knee towards my chest, make sure I don't feel any sort of pinch. When I find that range of motion, I'm going to let go with the band, make sure the pinching doesn't come back, and if it doesn't, I'm going to go ahead and eccentrically lower my leg back down. So essentially what we're doing is we're strengthening that hip flexor, getting it to work a little bit harder and a little bit stronger so that you're able to keep the head of that femur really well centered in the socket and start to get rid of that pinching sensation.